Good morning, Miss Yan. You're the mother of baby Annie.
Yes.
Okay, I am Nurse Daline and I am assigned to assess your baby's anthropometric measurements. So, may I know if I can have her with me for a while for the assessment?
Yes, of course.
Okay, thank you. So, just to inform you why it is important for us to obtain your baby's anthropometric measurement, it is because it is vital for diagnostic purposes. First, we're able to know if there are presence of abnormalities such as deformities in the baby. So we do this as early as the baby is born so that we're able to give an immediate interventions if there are problems that are existing. So I will be having your baby for a moment. Thank you, and
Thank
I will
you so
be
much.
Thank you, and I will be right back after the assessment.
Okay.
So today I have here with me baby Emmy, and I'm going to perform assessment on her anthropometric measurements. So that includes measurement of her length, her weight, and her body circumferences, such as the head circumference, chest circumference, and waist circumference. So baby Emmy is 42 weeks gestational age. So now let's perform measurement of baby Emmy's length. In hospitals, they use Anthropometric to measure the baby's length. Whereas it is a long board, a plain board with a movable footboard. But without one, we can use a measuring tape. In measuring the baby's length, usually we do this with assistant measurer. Assistant measurer usually help us to stabilize the position of the baby for us to have an accurate measurement of the length. In measuring the length of the baby, we should take note the baby's posture. The head should be aligned straight with her chest and her waist. So usually the assistant measurer is holding the baby's hand at the back a little bit and cupping, and her palm cupping both of the baby's ear, and making sure that the posture of the baby is straight and her head and her back is not curving. For today, I will going to perform the measurement of the baby's length alone. It is advisable to let the baby come first before proceeding with the measurement for us to have an accurate measurement. Whereas the baby is in a stable manner. So in getting the measurement, we will going to use a centimeter. And we should take note for us to easily bend and extend or stretch the baby's legs. We should remove their diapers that sometimes hinders the baby's legs to be stretched. We're going to remove her diaper first. And remove their dresses. Getting the baby's length starts from the top of the head, and we're going to put a little pressure on the baby's knees, just a little bit, not causing harm and injury to the baby, because Newborn and premature babies, their legs are very fragile, and we need to take care of those, not to really stretch it just enough to its limit. So this baby's length is 36 centimeters. For a baby boy that has a 42 weeks gestation age, their normal range of their length is ranging from 46.8 centimeters to 53.1 centimeters. Whereas for a baby girl, it ranges from 46.1 to 52.2. So now we will going to move forward in measuring the baby's body circumference, starting from their head. Still measuring the baby's head, we're still using a tape measure. So I will just position the baby near the camera. Usually we're using the same landmarks in getting the measurement. Usually it is just above the ears. We're letting the measuring tape to pass just above the eyebrows of the baby. And then getting the measurement just above the ears. So baby Emmy's head circumference is 28 centimeters. For a baby boy that is born in 42 weeks gestation, usually the normal range of their head circumferences varies from 32.2 to 36.6, whereas if it's a baby girl, if she is a baby girl, it varies from 31.7 to 35.9. So now we're going to move forward in measuring the chest circumference of the baby. To measure the chest circumference, we're going to let the tape measure go under the baby's back, and we're going to pass through over the nipple. Baby's chest varies from, usually if it's a baby girl, it varies from, and also a baby boy with 42 weeks gestation, it varies from 30 to 33 centimeters. So baby Emmy measures 30 centimeters chest circumference. Moving on, we're going to measure baby Emmy's waist circumference. And measuring baby Emmy's waist circumference, we will let the measuring tape pass through 2 centimeters below the belly button of the baby. measure it. Baby Emmy's waistline and waist measurement measures 30 centimeters as well. Usually, baby's chest and waist measurement are the same, but the normal measurement of the newborn's chest is 30 to 33 centimeters, whereas the waist is 41 to 44 centimeters. Now we're going to measure the weight of baby Emmy. So before we proceed on weighing the baby, there are things that we need to take considerate because sometimes there are cultures that prohibits the baby to be entirely naked. So um, in measuring the baby's weight, we need to take off all the clothes of the baby if it's possible. But if not, we can perform the weighing with the baby having her clothes on it. But we need to pair the measurement of the baby's clothes to the final weight of the baby. We need to make sure that the baby is relaxed and not moving agitatedly so that we can obtain a accurate measurement. So once the weighing scale, the baby scale reads the measurement. So for a newborn baby and 42 weeks gestation, usually the normal range of their weight for a baby boy is 2.63 kilograms to 4.22 kilograms. For a girl, the normal measurement varies from 2.55 to 4.08 kilograms. After obtaining all the necessary anthropometric measurements of the baby, make sure to replace the baby's diaper with clean ones and put on her clothes again. Now the baby has her new clean diapers, and let's now put on the baby's clean and warm dress. Now the baby is nice, clean, and comfy. Newborns have many reflexes, and not just newborns, but babies usually below 1 year old. One of the reflexes that we can observe the babies is moral reflex or startle reflex. This reflex in infants they develop while they are still inside their mommy's womb. Usually, this moral reflex is developed between 28 to 32 weeks of gestation, and when they finally come out into the world, we can observe this when they suddenly outstretch their arms like this and they started to pull it up again close to their body. And usually they do this when they are startled or they sense a sudden motion around them or a noise around them. But this moral reflex just happens in a primitive stage, usually after 3 to 6 months of the baby, it disappears. And these reflexes are essential as well for diagnosis and assessment for the development of the nervous system of the baby. So that's all. Thank you for watching. Again, I am Nalinian.